It took us all by such shock. Tom, my brother, having a heart attack? No, it was impossible. Not Tom. Tom never knew that he had this problem. And that, of course, put the red flags up for me. Within 30 days of Tom's passing, I was getting prepped for surgery. I'm really thankful to my brother for saving my life.
Cleaned and cracked. Got it. Pick up on the 24th at 10 o'clock. Thank you.
Hi, Dave.
Yes.
Steve Packer, how are you?
Hi, nice to meet you.
Thanks for having me at your shop today. This is, I've spent a lot of time here eating before. I've never had a chance to meet you.
We've been buying and selling fish locally for a good 30 years almost now.
My sister is taking care of the Monterey store.
Right.
And Moss Landing right now, so my brothers can concentrate on fishing.
We always felt like we've had this golden bubble over us. And it seems like we got a little chink in it when Mom and Dad died. Then after that, Tom passed away.
The day Tom passed away, he said to his wife, "I'll see you at the finish line." Tom passed away instantly before he hit the ground of a massive heart attack. We were out waiting here at the restaurant.
200 yards from the finish line.
Yes.
We were gonna all try and meet up for lunch. And then I see Dr. Smith. I knew something was up. He tells me that Tom passed away. I couldn't comprehend it at that moment.
So I informed everybody in my family.
Everybody was in just total shock. We couldn't believe that that had happened.
Tom was 61 years old, healthy, beyond anybody's imagination. Tom would get a medical every year, passed with flying colors.
He had no signs whatsoever, just like me. It came down to the way my body absorbs calcium. That's what happened to Tom and gave him a massive heart attack. This was a total eye-opener, awakening moment for all of us.
Some other friends of mine had this test that was called a calcium score test.
Dr. K immediately said, yes, go get the calcium score done.
When I got the score, the scale only goes up to 400. Mine was 1,650 or something like that, off the Richter scale.
After 400, you need to look at other factors quickly.
I went to Dr. Gerber, and he recommended that we do an
angiogram.
Correct. And I was kind of bummed because we were talking about stents.
Yeah.
And when you do stents, you're on a blood thinner. So I couldn't cycle for about a year because anything where I could injure myself and cause the bleeding would be problematic. Dr. Gerber says, David, I've got some good news and bad news. The good news is you're not going to have stents.
He just told me we've got major blockage and we need to get this taken care of. We're going to have to do other options here. Bypass surgery is going to be what's going to happen next for you.
So I said, okay, since I'm here, how soon can we do it?
We'll start tomorrow morning. And they'll start prepping you at 4 o'clock in the morning. The night before, I was antsy, you know, just kind of getting ready to go into surgery, getting my mind ready. It was hard. That's hard, because you don't know at that point. Is everything going to go okay? There's always risks involved in surgery, always risks. You try not to dwell on it and think of the positive, and that you're good with everything. And I was. I was good with my family. We all know we loved each other. My wife was there. She was by my side, so it was okay.
We're in the hospital, It's evidently a 7-hour surgery. It ends up being 6 bypasses.
Wow.
And when I come out of surgery,
I asked Dr. Spowert, I said, so I've heard of 2 and 3 and 4 on some people, but never 6. He said, 6, I can count on 2 hands. 7, I can count on 1 hand. You got 6 bypass open heart surgery.
his assistant was telling me before my surgery started, it was just thump, thump, just getting along.
When she reconnected everything and they kick-started the heart again, she said it was a full-on just whoosh,
Whoosh, just a fantastic pump system.
About 4 days, they said, okay, you're ready to go home and heal up there. I started by walking around the block, slowly, ended up walking around the beach every day.
Each step gets a little easier over time, which is just fantastic feeling.
I went to cardiac rehab.
The Peninsula Wellness Center over in Marina.
They set up a program for me.
The advantage that I have and had because of my exercise, I was able to heal, I think, so much quicker, and it helped me in my rehabilitation on getting back to where I am.
Finally, they said, okay, you're ready to do this on your own.
So you graduated.
We graduated.
Inside, my heart felt great.
The big turning point for me was we do this annual ride with a group of friends down the coast. And it's a 100-mile ride. And everybody else kind of loaded up on the bus and said, we're going to start from Big Sur. And I said, nope, I'm going to do it. I'm doing the whole thing. I took off at 7 o'clock in the morning and I'm going down the coast, and I passed where Tom passed away. Had a moment there.
I love Tom, miss him. Happy to have my brothers and family here.
And then had the best ride of my life.
Well, good afternoon, and thank you for joining us today. Today, I'm joined on the stage by David Deyerle. David, thanks so much for sharing your remarkable story with us. That video was just really inspirational. I appreciate you taking the time to share that story. So we heard about a 100-mile bike ride. Have you been back on your bike since, and what are you doing these days?
Oh yes, I'm on my bike almost every day. I'm biking, hiking, and swimming. I do some form of exercise every day. It's just wonderful.
Great. And I assume that you're seeing a doctor on a regular basis and getting regular follow-up as well?
Yep. Dr. Terry Moran is helping me with my lipids.
Great, perfect.
We're following up on that, and everything's good.
Well,
Just
super.
wonderful.
Thanks again for joining us. We're so glad that you're doing so well.
Thank you.
Really appreciate it.
Thank you.
Bye-bye. Congratulations.
Okay.
David's diagnosis and his treatment involved the care of many dedicated and caring and talented individuals, and many of them are here today. David's joined today by his wife, Tina, and by many friends and family, people he runs with, people he bikes with on a regular basis. We're joined today by several of the physicians who provided David with his care. We have Dr. Rich Gerber, Dr. Soteria Karahalios, Dr. Greg Spowert. I'm sure I'm missing a doctor there as well. But we have a number of members of the team, and we appreciate all that everyone did to assist in David's diagnosis and his really remarkable recovery. You helped to turn the tragedy of Tom Deyerle's death into a life-saving effort for David, and more importantly, and as importantly, probably for many other individuals as well who've heard David's story and have gotten tested and have really addressed underlying problems that have been identified. So I appreciate all of the care that many of you have provided to David and to others. You know, community hospitals enormously proud to have participated in David's care. And you think about it, David did all the right things, right? He got checkups on a regular basis, physically very, very active. I understand he eats a lot of fish, has a good diet, has a strong social life and good family support, but he really couldn't undo what genetics had done. And he had to really, for that, he had to turn to the superb physicians at Community Hospital for their care and their expertise. And that's our commitment to you, to be here and ready when you need us. To borrow a term from other industries where risk is high and safety is paramount, industries like aviation, we strive to be what's called a high reliability organization. High reliability means building systems and practices that yield the best results, practices that can be refined and tested and reproduced, and results that can also be measured and tested. A few years ago, we took those high reliability principles and we applied them to the care of our stroke patients. We were dedicated to becoming the leader in stroke care in our region. So we assembled a team, we put in place practices to quickly recognize and treat stroke, and those practices we tested, we tracked, and we've demonstrated that they're proven to produce the best results. Our efforts have paid off. The Joint Commission, our accreditation agency, accredited our center as the first stroke center in Monterey County, and we've since been reaccredited twice. Late last year, the American Stroke Association awarded us their Gold Plus Quality Achievement Award for our efforts. Now, there are lots of different kinds of strokes, but when a blood clot is the cause of a stroke, time is really of the essence. We need to get in and relieve that blockage as soon as possible. So we developed systems to rapidly diagnose and treat strokes. In fact, 23% more of our patients, when compared to national average, receive clot-busting TPA within the first hour, that critical 60 minutes, when they present to our emergency department. And that gives these patients the greatest chance of surviving without a significant deficit. Now, while accreditation and statistics help to tell the story, so do our patients. And after suffering a stroke, Monterey Herald writer Phil Boway wrote this in his column. He said, "There are a few magic words in the ER. One, of course, is heart. Another is stroke. And as I stood in the Chomp ER and I murmured, I think I might be having a stroke, I'm not kidding you. Within 30 seconds, they were like bees to honey, and I'm here to tell the tale." Yeah, Phil is here to tell the tale, and many other patients are as well, as a result of high reliability initiatives that we've built around the care of stroke patients and other very common and life-threatening illnesses. Another area we've targeted relentlessly is in the area of infections. Infections concern everyone, and in fact, they're one of the biggest concerns patients have when they enter a hospital. So first and foremost, we launched an antibiotic stewardship program to ensure the safe, consistent, and judicious use of antibiotics. And sometimes that means using no antibiotics at all. And in other times, in fact, in most cases, we want to just be sure that patients are receiving the right antibiotic, the right time, the right route, and for the right duration, not too long, not too short. However, often, using the right antibiotic doesn't mean using the strongest antibiotic or the newest antibiotic or the broadest spectrum antibiotic. Because if we use strong, powerful antibiotics in every instance, we run the risk of creating superbugs like MRSA. As a result of our careful antibiotic stewardship, community hospital incidence of superbugs is consistently lower than regional, state, and national averages. We also took on another type of infection, common and potentially devastating, and that is central line infections. They come from the use of IV catheters that are placed in a hospital to administer medications. Through the use of consistent, evidence-based best practices both in the placement of the central line and then the maintenance and the care of those central lines, we've experienced 0 central line infections for the last 18 consecutive months. Then we set our sights on sepsis, and sepsis is a leading cause of death in intensive care units all across the United States. We made it a strategic initiative because lives depend on early recognition and treatment of sepsis. So we brought a mobile simulation lab to our hospital to train our physicians and our nurses so that they could easily recognize the early signs and symptoms of sepsis and aggressively intervene with early treatment. We modified our electronic health record so that it requires or prompts physicians and nurses to take certain steps when there are signs of sepsis before they can move on and enter any other orders. With these actions, sepsis mortality rates have dropped dramatically at community hospital. We've experienced 57 fewer deaths over the course of 5 years as a result of our efforts in sepsis. Now, some of these initiatives may sound simple. Well, of course, every hospital would do these things. Why wouldn't you do them? But in fact, many of these initiatives are complex undertakings. It requires a change in behavior. It requires a change in the way people have always done things. It requires a change in culture. But the payoff is huge. We now have more satisfied and, more importantly, safer patients. Another initiative that we launched in this last year was the bedside handoff initiative, whereby we take our nursing shift handoff, which has historically taken place at a nursing station, back to the bedside. So today, when a nurse is going off shift and another nurse is coming on shift, when they're exchanging critical information, it takes place at the bedside with the patient participating. So the patient can hear plans for the day, what tests are being ordered, what new medications are being administered, what activity is allowed. And the patient can participate and be actively involved in their care. And this makes a huge difference. In the past, when we surveyed our patients following a discharge from the hospital and we asked them about their discharge instructions, many reported that they either did not receive any discharge instructions or they didn't understand the instructions they received. So this past year, we set out to enhance communications throughout the discharge process. And one of the projects that we launched is we introduced a discharge phone call program. And our aim is to call every single patient discharged from the hospital within 72 hours of their discharge. And that equates to about a little under 12,000 patients every year, and certainly more than 12,000 phone calls. So we check in with them, we ask them how they're doing, we ask if they understand their medications, and we reinforce key instructions. And now, when patients are surveyed, we receive a nearly unanimous response that they've received and they understand what their activity can be, what their medications are, they understand their discharge instructions. In our emergency department, which this past year saw a little over 51,000 visits, we began identifying recurrent, frequent visitors to our emergency department. Sometimes we had patients who were visiting our ED as many as 73 times in a single year. So we sought to really understand what's bringing these patients back to our emergency department. Is it a lack of a primary care physician? Is it a lack of insurance? Is it a lack of transportation to another care venue, so easier just to call the ambulance? We sought to understand what was driving them to our emergency department, and then we hired a team of nurses that we call transition of care nurses. These nurses work with these frequent visitors, and they work with them to develop a plan of care that calls for more appropriate, less expensive, more appropriate venues of care. And this has been a very successful undertaking. In the last year, we've reduced use by our most frequent visitors by 55%, from an average of 21 visits over the course of a year to less than 10 visits over the course of a year. And that's important. Why? It's important because it frees up critical capacity, vital capacity in our emergency department for others who need to use and access the emergency room in a timely fashion. In 2015, we will continue our evolution as a high reliability organization as we seek new accreditations, launch new initiatives, and seek to meet the triple aim: better health, better care at a lower cost. Aspire Health, our new Medicare Advantage health plan, is now in its second year. CHI, or Community Health Innovations, our company overseeing efforts like our transition of care managers in the emergency department or care coordinators of our most chronically ill outpatients, continues to grow. We are redoubling our efforts to recruit more physicians to our area to meet the needs of the community, both primary care physicians and specialists. And we remain committed to our emphasis on wellness through entities like Peninsula Wellness Center, which will be opening a second site in North Salinas in 2015. None of our effort would be possible without two very important groups. First and foremost, our Board of Trustees, talented, experienced, and engaged individuals who collectively donate thousands of hours towards leading our organization. They really are the stewards overseeing our hospital on behalf of you, our community. And our second group is you, our community, who support us so many ways. You provide generous philanthropy, you provide dedicated volunteering, and most importantly, you entrust us with your care. Thank you. As a result of your continued support, 2015 really promises to be another exciting and positive year for our hospital and for the health of our community. But most importantly, we will continue to focus on our work on quality, safety, and the reliability of our care so that when people like David Deyerle need us, we will be here for him and we will be here for you.